Next, we have scalable psychological first aid, implementing problem management in war settings. Anna YABLUCHANSKA, UHU, United Help Ukraine.
Thank you so much. Good evening, everyone. Nice to have you here today, and thank you for the opportunity to talk to you.
While they're working on that, we're also, we wanted, the nurse that was speaking wanted to have a couple more minutes telling about one of her projects. Tomorrow we're going to start at 8:15, 15 minutes earlier to make sure everybody gets their chance. I mean, we really don't want to, we probably are very physician heavy here, so we want to make sure the nurses get some time.
Okay, we have some technical issues, but we can start. So we all know today that Ukraine is in war, unfortunately, and it's in PDF. Yes, good. Okay. How it? Okay, thank you so much. How can I? Okay, thank you. So there is some official statistics regarding Ukraine. We know that at the beginning of this year, we had over 4.6 million internally displaced people. Per Ministry of Internal Affairs, 1.3 million of people who have a status of the veteran of combat operations. Per United Nations, a human rights monitoring mission, as of September of 2025, 14,000 people, civilian people, were killed, and 36.5 thousand people were injured. And the number of victims, unfortunately, only this year increased 31% in comparison with the previous year. So it's also coming from our official officials who estimate that in Mariupol only we had about 20,000 people killed. That means that we have a lot of people who are grieving. We have a lot of people who experience psychological trauma. And as we heard in one of our previous sessions, unfortunately, we don't have enough mental health professionals. We don't have enough psychiatrists available. So additional to that, as soon as we are in the war conditions, so we still see that a lot of people are drafted to the army. We see a lot of veterans who are coming back to the communities, and these people are with certain psychological issues. We have a lot of people who have some physical disabilities, and so they and their families already suffer from them. We have orphans, we have widows, and this all should lead us to a situation that we need to think how we can help on a community level, because unfortunately, we cannot reach out to every exact patient. So in this presentation, we just wanted to tell a little bit what United Help Ukraine started to do this year. It's not a very huge experience yet, but it's already impressive for us, and we enjoy it. So this is a problem management plus program that was designed by WHO, which is an evidence-based psychological approach. It was, and it's individual psychological assistance that can work on the community level. And what is good, that it is short-term and it's scalable. So the idea is to teach as much people as possible to be able to provide such kind of services to those who suffer from different types of psychological trauma. So PM Plus, how it works. So it's a protocol-based. And this is nice, because we don't need to make any decisions and to think what to do. We just follow the steps. And it provides assistance in solving psychological problems like different types, like life-threatening conditions, like fear, like different feelings, grief. And it also helps to solve practical issues. And through this, through this protocol, going step by step, it helps to restore in the client their effective cognitive and behavioral skills. And it helps to develop a plan how to overcome these conditions using person's internal and external assets. And it develops skills for overcoming distress, step-by-step actions, and help a person to set goals. So who is the audience? It's all Ukrainian population today, unfortunately. It's people on the front lines, it's people somewhere in the center of the town, country, which are currently, we all heard the sirens recently, so something is happening somewhere. So anybody in Ukraine could be a target audience. But how we can reach to them? So the best way is to use the resources that are already in country. So what we have, we are Ukrainian diaspora NGO who has representative office in Ukraine, and we of course do our best. But what can we do on a country level? That's why we try to communicate and to build partnerships within Ukraine. So we're working with the resilience centers, which already presented in all regions of Ukraine. We had, I guess, 279 in June, and it's already increased the number, and we have a lot of medical facilities where psychologists are working. So the idea is to bring this skill, which is very practical, to as much people as possible, to as much psychologists and social workers who can assist population. So the training is easy. We have trainers who are WHO certified, absolutely excellent people. And the training the overall program is just 3 months. So we have 5 days of in-person training and then 2 months of supervisions. Every psychologist will recruit 3 clients that will go under this training. Like during this training, they will go through 10 sessions with the client, and trainers will perform 13 individual sessions with every of the psychologists and will perform 3 group supervisions. As a result, we had so far 3 training sessions in this year. So we did one for Ivano-Frankivsk. We've heard a lot of stuff what's happening in Ivano-Frankivsk, and I'm really happy about this town because it's a huge support. So I'm really impressed. So we trained resilience centers from Ivano-Frankivsk, covering all of them in the region. Also, we did the same for Vinnytsia. And the last one, we were approached by the Ministry of Internal Affairs with the same question. They said, please help our medical facilities, because we also dealing with the veterans. We have National Guards, we have border protectors, but we also working with the prisoners of war. And when they are exchanged and are coming back, they are coming to our facilities. And we need our psychologists to be able to work with them and to work with them and their family members. So this is one more segment we are working on right now. So, as I said, only 1 year of work, but 54 psychologists trained. What I would say, we had none case of coming out. None of them quit the program. And we have already a huge line for those trainings. We now have a lot of plans how to expand next year in terms of number of trainings and additional regions in Ukraine. So, yeah, so And as this is a protocol, it also has methodology that provides survey of the clients before the session started and after it's finished. And in 10 sessions, we see a huge improvement of the psychological condition of the clients. So it, by distress scale, it was improved by 51%, and by functional scale by 62%. Yeah. So we would be glad to expand more, and we'll be glad to search for additional programs. Also, if you have any ideas and you can share with us, please reach out. We will be happy to discuss and implement them in Ukraine. Thank you.